All right. So I hope we are live. All right. I hope we are live. So good evening, everyone. I'll just wait for a while for some of the people to join, and once you are there, then I think we can start. All right. Hi. Good evening, Adil, Hitesh. Good evening. Hi, RG. Good evening. So just let's wait for another 30 seconds, and then I'll be ready to start. Good evening, Zala. Good evening, D7. Okay. So today here we are supposed to discuss all the PYTs. I hope that these sessions which are being conducted by DBMCI FMG, they are very helpful to all of you, and they will be proving as one resort for your last minute revision of all the 19 subject. Okay. So we are going to conduct the revision plans, revision classes of all the 19, right? And yesterday we had a session of medicine. Today we are going to have the session of orthopedics, and so on. We are going to have the sessions of different subjects one by one, right? But we are going to make sure that all our faculties who have been teaching all the students for last so many years, they are going to give you the best, crisp, and the concise content in the most conceptual manner, so that you remember everything in your exam and you all clear your FMG exam with the flying colors, right? So many are here. Good to see you all. Arshad, Disha, Pradyuman, S.A. Gulam, okay, MBBS and double graduate. Oh, so good. So Rohit, D7. So good to see you all, guys. I hope you are ready to start. Audio, video, both are okay. Okay, so this is the list of PYT, right? And that is available all the time on your Triple S group, the study with Dr. Sakshi ma'am and Dr. Sushil. So that is me. So those who are new and looking at this video for the very first time, meeting me for the first time, guys, I am Dr. Sushil. I'm your orthopedic faculty and your mentor at DBMC FMG segment. And me, along with Dr. Sakshi, we are having this group that you all know is the Triple S. Okay. So, hi, good evening, D7 Pranit, Cricket 247, Zishan. Okay, so good evening, everyone. Utkarsh, chalo shuru kare. So many are here now. We are ready to start, I guess. Can we get the PDF of this session? Subhojit, session to shuru hone do yaar. Bina session ke PDF chahiye. लिखते जाओ. Whatever I am going to write are all the important, most important volatile points जो मिस भी कर जाते हो और एग्जाम के अंदर मिस कभी करने ही नहीं है, राइट? ओके, सो अब शुरू करते हैं. पीडीएफ क्या मिलेगा नहीं मिलेगा हम सब बाद में बात करेंगे. इस बार 200 बार ये बात हुई ना मोहम्मद. सो गुड. डॉक्टर लेवेंदर, प्रणित, ठीक है, चलो शुरू करें. हाय प्रणवी, गुड इवनिंग. चलो बच्चों देखो, दिस इज द लिस्ट ऑफ पीवाईटीज दैट वी हैव, जहां से क्वेश्चंस यूजुअली सबसे ज्यादा पूछे गए, राइट? इन द Utkarsh, thank you so much, Utkarsh. Chalo, you were waiting for my class, so let's make it the worthy waiting time, right? देखो, these are topics from trauma, जहां से बहुत सारे क्वेश्चन पूछे गए in the recent sessions of the exam in last 4 years, 5 years. Okay, topics from trauma, topics from the nerve injury, topic from the metabolic disorder, topic from tumors, pediatric disorders, joint disorders, deformities. कहां से क्या क्या आया? Okay, so I am going to discuss all the important points about all the topics here, right? So good evening, Rahul, Amrita. Chamrita is here. Good evening, Amrita. Which topics you will cover? I'll cover all the topics. I'll give you the points about all the PYTs. जितने भी आए हैं ना, I'll give you the important points कि क्या mark करना है, क्या mark नहीं करना है. And I hope that everybody is comfortable with Hindi and English, both the languages. शुरू करते हैं, right? So now from the trauma segment I'll start. देखो, ट्रॉमा के अंदर there are few important topics which are very important and have been asked number of times, and I'll add up a few here. जो नहीं है that I'll add up, right? So first topic we have is the Colles and the Smith. Okay, so fractures. I'm not going in any sequence. I'm just going as per the list. Okay, so what are the trauma topics जो बहुत बार पूछे गए, questions from which have been asked multiple number of times. अभी तो जिशान शुरू ही नहीं हुआ, पीडीएफ मिलेगा कि नहीं, सेशन कितना लंबा चलेगा. शुरू करते हैं ना, देखते हैं. जब तक हिम्मत होगी, पढ़ना ही तो है, और क्या काम है हमारे पास, है ना? वी डोंट हैव एनी अदर वर्क टू डू. पढ़ना ही है अब तो हमारा काम. सो ट्रॉमा के अंदर द वेरी फर्स्ट वन गाइस इज कोलीज एंड स्मिथ. ओके, द वेरी फर्स्ट वन इज कोलीज एंड स्मिथ। देखो आपके एग्जाम में most important things to be remembered. Number one, the Coley's part and the Smith part. What is the most important point to be remembered about these two, Coley's and Smith? That both of these are what kind of fractures? Both of these are extra articular, right? Extra articular का मतलब कहाँ पे है fracture lines? Where are they? Extra articular मतलब that when you look at the distal end of radius, not ulna. Remember this, please. Then fracture is here. Not going into which joint? Not going into this radiocarpal joint. Okay, not going into the radiocarpal joint. So usko breach nahi karega. Coley's and Smith both are same. And what is the biggest difference in both of them? The difference in both of them is about their displacements. It is about their displacements. What are the displacements we see in Coley's? What are the displacements we can see? There are 6 displacements, remember, right? Telegram group link. Okay, I'll share the Telegram group link. मैं भेज देता हूँ आपको Telegram group link. There is no worry in that. All right, I'll share that Telegram group link. Okay, so let me just do that. ये वाला group link is there. अभी ना no distractions. पूरा का पूरा focus only onto the session, right? इसके अलावा कहीं नहीं भागना है और कोई बात नहीं करनी, सिर्फ क्वेश्चंस की बात करो, टॉपिक्स की बात करो। ओके, आई हैव शेयर्ड द लिंक इन द ग्रुप। ओके, बाद में सारी तैयारी चलती रहेगी। ओके, बाद में सब बातें करते रहना। नाउ बी फोकस्ड ऑन टू द सेशन एंड नथिंग एल्स अदर देन दिस, कोई बात इसके अलावा नहीं। ओके, चलो। नाउ दिस डिस्प्लेसमेंट कौन कौन से होते हैं कोलीज में एंड स्मिथ में? देयर आर 6 डिस्प्लेसमेंट्स व्हिच यू कैन रिमेंबर बाय व्हिच निमोनिक? लिड्स, द eyelids. ओके, सो रिमेंबर द लिड्स, L I D S, lids. L stands for what? L is basically the lateral displacement and lateral tilt. I is for impaction. I is for what? Impaction. D is dorsal displacement and dorsal tilt. And S is for supination. देखो, you are learning 6 displacements here, right? We are learning 6 displacements here. 6 displacements में you have lateral displacement, dorsal displacement, supination and impaction, right? ये 4 सबसे important याद रखने हैं। okay, अगर कौन से वाले fragment की हम बात कर रहे हैं, you can see that this is a distal fragment, this is proximal fragment ना। which fragment is going on which side? The distal fragment, ये वाला distal fragment is going laterally, distal fragment is going dorsally, distal fragment is going into supination, distal fragment is going into impaction. Impaction मतलब क्या? 2 fragments of the bone are getting into each other. How? When somebody is just falling down, right? तो ये impact होगा and these 2 fragments will get into each other. All right. Now see, Smith में how is it different? In the Smith, instead of lateral, what will be the kind of displacement? It will be the medial displacement, right? It will be medial displacement. Instead of dorsal part, there will be lateral displacement. This dorsal, my bad, sorry. The dorsal part, there will be palmar displacement or the ventral displacement. Okay, so अगर dorsal की जगह fragment, so what view? Please tell me guys, all of you, those who are live with me, अब बताओ इनके अंदर what view would you like to have जिससे पता लगेगा कि is the displacement dorsal one or a palmar one? कैसे, कौन सा view चाहिए? Will you be able to check that in the AP view, lateral view? Which one is required? कौन सा view चाहिए? So Coley's के एक्सरे में, Smith के एक्सरे में, what is the best view to identify? Is it Coley's or is it Smith? How will you identify? कैसे मालूम पड़ेगा? Can you tell me that? Very good, Ankita, RG, yes. तो अब इनके लिए what I need is simply a lateral view, right? It is a lateral view. Now, if the fragment comes on the palmar side, it becomes what? Smith. If the fragment goes on the back side, it becomes what? Coley's. Okay. अब अगर fragment is going on back, it is going to create what kind of hump? It is going to create what hump? Hump on the back, and that is why the Coley's fracture comes up with what deformity? याद रखना है, don't miss it. The deformity is not to be missed. It is dinner-fork deformity. It will be dinner-fork deformity. And if it is the palmar side, then the fragment here, it goes in front, so straight and sudden depression will be there, right? That is going to create what kind of deformity? What do you call that? Garden spade deformity. Garden spade deformity. Okay, or which is the most commonest fracture that occurs overall in anyone? The most commonest fracture that occurs overall in anyone is Coley's fracture. अब if somebody comes to you with a Coley's fracture, what kind of plaster will you give? कौन सा plaster दोगे? कैसे दोगे plaster? The plaster has to be given with the rest in palmar flexion and ulnar deviation ऐसे, right? What do you call that? The shake hand position, right? So plaster की position क्या होगी? Plaster की position क्या होगी? Shake hand or the handshake, right? The shake hand position or what we call as the handshake position. Handshake, shake hand, same thing, right? So handshake position, okay? Kohli is most common. Utkarsh, you are right, absolutely correct, okay? So ये सारे MCQs है हमारे एग्जाम के. कैसे प्लास्टर देंगे, कौन सा डिस्प्लेसमेंट होगा, हाउ टू आइडेंटिफाई. Yeah, so handshake plaster, very good Sahana, Sadhna, Pranshu, everyone, very good, okay? So Kohli's or Smith, no mistakes at all, no mistakes at all. Kohli's and Smith, these are few points which you should always remember about these two, right? So Kohli Smith में कोई गलती नहीं होनी चाहिए, no mistakes at all, right? Second one is Montegia and Galizzi. Let me open up my PPT also so that I can show you some images also side by side. Images भी देखते रहेंगे तो it will be little easier for us, right? तो थोड़ा easy हो जाएगा हमारे लिए. So I'll just show you Kohli Smith और ये सारी injuries also. I'll keep on showing you so that you can recall it later easily. देखो how to differentiate. अब देख लो इन दोनों images को देखो. You can see these two images. I'll mark very quickly, right? A and B. So in the image A it is the thumb. In the image B it is the thumb. Thumb का मतलब this side is the palmar side. This side is the palmar side. और image A में देखो क्या हो रहा है, distal fragment is coming on to palmar side. Image B में distal fragment is going on to dorsal side. इसीलिए the image 1 becomes what kind of fracture? It is Smith fracture. And image 2 becomes what kind of fracture? Kohli's fracture, right? So yeah, thumb is open, absolutely correct, okay? So remember the palmar side displacement is Smith and Kohli's. Now second injury I want you to remember is the forearm injury. देखो forearm के अंदर how do we make out the injury? How do we make out this is Montegia and Galizzi. I'm just putting both the x-rays side by side so that we can just discuss them, right? देखो second injury is this one. Second injury में what we have to make out? Second injury में what we have to make out is this is now x-ray A and x-ray B. Tell me what is the diagnosis for x-ray A? केपी अभी ध्यान दो, जो चल रहा है उस पर ध्यान दो. डोंट डिस्ट्रैक्ट एवरीवन एंड डोंट गेट डिस्ट्रैक्टेड योरसेल्फ एज वेल. करते जाओ. आई विल मेक श्योर कि सारे पीवाईटीज कवर होंगे, डोंट वरी. बट अभी जो चल रहा है ना उसके बीच में डिस्ट्रैक्शंस मत आओ, ठीक है? बताओ विच वन इज दैट? ए इज विच वन? ए क्या है? डायग्नोसिस बताओ फटाफट, क्विक. चलो बताओ. ए के अंदर व्हाट डू यू सी? देयर इज अ फ्रैक्चर ऑफ प्रॉक्सिमल 1/3 ऑफ ulna, fracture of proximal 1/3 of ulna, right? And along with that what else you can see? Along with that okay, right, along with that there is a dislocation of the head of the radius, right? There is a dislocation of the head of the radius. Now I want you all to remember two most important things here, right? I want you to remember two most important things over here. क्या? One is the image based question. Image based में everybody can recognize it is Montegia, right? And second one इसमें nerve कौन सी involve होगी? सबसे commonest nerve will be posterior interosseous nerve. Most commonest nerve to be involved is posterior interosseous nerve, right? PIN, which is a branch of the radial nerve, okay? So first one will be Montegia and second one देखो, fracture of distal 1/3 of the radius with dislocation of the distal ulna, right? This one will be called as what? Galizzi fracture, okay? And Galizzi ka other name, what is the other name for Galizzi? Galizzi's other name is the fracture of necessity. Galizzi's other name is the fracture of necessity, right? So one is Montegia, the first one is Montegia, nerve involved will be posterior interosseous nerve, and second one is Galizzi, the fracture of necessity. Nahi beta, not radial now, Utkarsh, KP, not radial. Acha, radial nerve you are telling as a branch, okay? So answer will be PIN, which is a branch of radial nerve. Yes, you're right. Okay, I understood that. I misinterpreted that you are telling the nerve involved. Okay, so PIN will be involved. Very good. Okay, so Galizzi, the fracture of necessity, and Montegia. These are two important injuries here. Okay, so no mistakes, PIN. I'm telling you all the questions only. So keep writing. साथ साथ लिखते रहो. So number one, I'm just sticking here. Have you done it? Yes, we have done this. Have you done Kohli Smith? Have you done Montegia? Okay, supracondylus. Now let's talk about supracondylar fracture. Supracondylar में what I want you all to remember. So certain very important points about the fracture of supracondylar humerus. Fracture of supracondylar humerus. देखो सबसे important बात, you should always remember when you say supracondylar, that means lower end of the humerus, trochlea, capitulum, lateral epicondyle, condylar area, like that. So we are talking about this region, supracondylar. What part of the bone is that? It is metaphysis, right? And being metaphyseal, you know that the viscolarity is very good. The bone is cancellous here, the bone is soft here, right? Supracondylars mein, what are the most important points to be remembered? Number one, what is the most commonest type of supracondylar fracture? What is the most commonest type? It is the extension type. What does that mean? Extension type. Most commonest type is which one? Extension type. That means this distal fragment. This is proximal fragment. When the injury will happen, please tell me, मुझे बताओ ये जब injury होगी तो ये distal fragment will be going to which side? It will be going to which side? Will it be going on the front side, anterior, or it will be going on the back side? बताओ कौन सा वाला? Which will go to which side? Most commonest is extension type. मतलब most commonest type is extension type. What does that mean? Extension है तो किधर जाएगा? Palmar side में कि dorsal side में? Which side it is going to go? Right. Second point is about the most important complications which are related to this one, right? Second one is about the most commonest complications which are related to supracondylar fractures. Backside, yes, it is on the backside. Ankita, you are absolutely right. Okay, अब complications में yellow वाले जो mark है ना, these are all your questions. Complications में overall, what is the most commonest nerve which can be involved? Which is the most commonest nerve to be involved? बच्चों बताओ फटाफट, quick. Most commonest nerve to be involved, it is anterior interosseous nerve, right? Most commonest to be nerved is anterior interosseous nerve. Second, which is the most commonest vessel to get involved in supracondylar? Most commonest vessel to get involved is supracondylar fracture. In the supracondylar fracture, it is your brachial artery. There is only one vessel over there, right? It is brachial artery. Number three, what is the most commonest complication overall in supracondylar? The most commonest complication overall in supracondylar, it is always malunion. You know very well, kyun? Because it is a metaphyseal area, right? So it is metaphyseal area, and if malunion is happening, what kind of deformity do you see in the elbow area? कौन सी deformity do you see here? Deformity to be seen is cubitus varus, which you also learn as which one? The gunstock. So cubitus varus or the gunstock deformity, right? So gunstock deformity. Number four, लिखते रहो साथ साथ विनय, लिखते रहो साथ साथ में, right? Keep writing. Don't expect me to send you anything. लिखते रहो. Everybody has to write down. It is not a movie कि हम आए, हमने देखा, रिवाइज किया, फिर भूल गए. When you write down, you will remember it for a longer time. जब तक लिखोगे नहीं, लिखा हुआ मटेरियल तो हर जगह है ना, और लिख के मटेरियल को इकट्ठा कब तक करते रहोगे? So you don't have to waste time. Once my session is over, your orthopedic should be very clear और सारे questions आने चाहिए. तो लिखते जाओ. Okay, keep writing along with me, and that is the only reason why I don't share my PDF, because content हर जगह पे available है. मुझे आपका टाइम वेस्ट नहीं करना है कि आप कल सुबह उठ के भी ऑर्थोपेडिक्स पढ़ रहे हो. आज रात को ऑर्थोपेडिक्स अभी खत्म करेंगे एंड विल रिवाइज इट थॉरोली. ओके, सो इसके अलावा कुछ नहीं, लिखते चले जाओ. सुप्राकॉन्डाइलर फ्रैक्चर्स में वेसल हो गई, नर्व हो गई, malunion हो गया, डिफॉर्मिटी हो गई, एंड द कॉम्प्लिकेशन विच कैन हैपन अलोंग विद दिस, द अदर कॉम्प्लिकेशन इज कंपार्टमेंट सिंड्रोम. नहीं बेटा, टार्डियल नर्व पेल्सी यहाँ नहीं है उत्कर्ष, यू आर कंफ्यूजिंग, रुक जाओ अभी, राइट? कंपार्टमेंट सिंड्रोम कैन ऑल्सो हैपन. सो प्लीज रिमेंबर, जब कंपार्टमेंट सिंड्रोम होगा, above what pressure you say that compartment pressure is rising? Above what pressure? The pressure above 30 millimeters of mercury, right? The pressure above 30 millimeters of mercury. Which is the most commonest fracture to be related to compartment syndrome? It is fracture diaphysis of tibia. It is fracture diaphysis of tibia. That is fracture shaft of the tibia. That is the commonest one, right? Most commonest fracture will be the fracture diaphysis of tibia. And in this, if you have to look at the clinical patient, clinically patient को देखना है, so what will be the first sign which is going to tell you कि patient को compartment develop हो गया है, शुरू हो गया है? So it is pain on passive stretch, right? The pain on passive stretch, not more than 35 beta Vinayak. It is more than 30 only. Okay, more than 30 only. Very good. So pain on passive stretch. Another 3 questions from you, for you from this, right? This is your supracondylar fracture. Yaad rakhna. Fifth point here. What is the name of the classification which is used for supracondylus? What is the name of the classification which is used for supracondylus? What is the name of that? It is called Gartland classification. नाम क्या है उसका? Gartland classification, right? So name of the classification is Gartland classification. Okay. Now, when somebody has gone into compartment syndrome, अगर उसको complication हो ही गया है, शुरू हो गया है, then how do you plan to treat them? What is the plan to treat them? अगर compartment syndrome शुरू हो गया है, so how do you treat them? The treatment is fasciotomy, right? The treatment has to be fasciotomy, और fasciotomy में superficial और deep दोनों fascias को cut करना है. Superficial and deep, both the fascias have to be resected. Okay, so याद रखना ये. Okay, so this has to be remembered. This has to be remembered, the supracondylar. Now, second question from the same region of the humerus is the fracture lateral condyle of humerus. ये बिल्कुल भी मिस नहीं करना है. It is the fracture of the lateral condyle of the humerus. Fracture of the lateral condyle of humerus, right? In the fracture lateral condyle humerus, you should know that कि lateral condyle पे which muscle is connected? कौन सी muscle attached है वहां पे? It is common extensor origin, right? So अगर common extensor origin होगा तो क्या होगा? Whenever you are moving your fingers, common extensor उस piece of bone को pull करके रखेगी. That is why lateral condyle of humerus, they have the most common complication as what? The most commonest complication as non-union, right? अगर ये non-union में होगा तो what that leads to, उससे क्या होगा? The parent bone is not connected to the small piece of bone, right? It leads to what deformity? Gradually जैसे जैसे बच्चा बड़ा होगा वैसे वैसे the forearm starts going lateral side, creating what deformity? Leading to cubitus valgus deformity. Okay, it is cubitus valgus. अब जब ये forearm will go laterally, stretch will be on the medial side, and that medial side stretch leads to involvement of which nerve? Now here we have the involvement of ulnar nerve in the late stages, and we call it what? Tardy ulnar nerve palsy. We call it what? Tardy ulnar nerve palsy. अब यहाँ पे याद रखना है. Okay, it is tardy ulnar nerve palsy, right? So tardy ulnar nerve यहाँ होता है. Okay, so this is the tardy ulnar nerve. याद रहेगा tardy ulnar nerve. Don't mix up this with the supracondylar. Supracondylar में which is the nerve involved? Anterior interosseous nerve. And in the lateral condyle, it is a tardy ulnar nerve palsy. Okay, so lateral condyle humerus का complication non-union, deformity valgus, and nerve involved ulnar nerve, not immediate, late, and that is why we call it tardy ulnar nerve palsy, right? So supracondylar, lateral condyle, ये दोनों याद रखना, दोनों याद रखना, very very important topics for your exam, right? So supracondylus and lateral condyle both are very important topics for your exam, right? अब आते हैं proximal humerus और shoulder dislocation के ऊपर. Proximal humerus और shoulder dislocation. देखो shoulder में when they talk about the dislocations, shoulder के सबसे important points exam के अंदर, how you have to crack the language of the question in shoulder. Shoulder में if they are asking you about the dislocation concept, if they are asking you about dislocation concept, right? अगर if you get in your exam that first of all देखो dislocation में which is the most commonest dislocation of the shoulder, which is the most commonest dislocation of the shoulder, the most commonest dislocation of the shoulder, it is anterior, right? Most commonest dislocation of the shoulder, it is anterior, right? और anterior होगा कैसे? Who will be your patient? Read the language of question very very carefully. ध्यान से पढ़ना. That person was trying to throw the ball. Person was holding a bar in a bus, metro, train like this. So shoulder already abduction external rotation में है, already है ऐसा, right? So anterior dislocation में how does the person comes to us? Abduction and external rotation. तो history अच्छे से पढ़ना, right? Important points about the anterior dislocation, it is that उसमें contour of the shoulder maintain नहीं होता, right? Contour is lost. Shoulder का contour will be definitely lost, right? This will be definitely lost. ये flat हो जाएगा बिल्कुल. तो flat हो जाएगा तो you can put a scale on acromion and lateral condyle, और ये दोनों point एक साथ touch करेंगे एक दूसरे को, right? So contour is lost, and after that, once the contour is lost, after that they also ask you which is the most commonest type of anterior dislocation. So anterior में the most commonest type is subcoracoid. Most commonest type is subcoracoid, right? Most commonest type is subcoracoid. Okay, and the method to reduce the dislocation, क्या नाम होता है उस टेस्ट का, कैसे करते हो आप reduce, कौन सा मेथड है वो? For reduction, the method is Cocker's method. What are the steps of Cocker's method? Traction, external rotation, adduction, and medial rotation. Traction, external rotation, adduction, and medial rotation. These are four, right? These are four. Shoulder dislocation में. दूसरा, अगर आपके एग्जाम में if you get a question where the patient is a known case of epilepsy, patient has got a trauma after electric shock, right? Epilepsy or electric shock, then what has to be your diagnosis? Agar patient is a case of epilepsy or the patient is a case of electric shock, epilepsy and electric shock, then it goes in favor of posterior dislocation, right? It goes in the favor of posterior dislocation, जिसमें सबसे important point क्या होगा? What will be the catch point in your exam? The catch point in your exam will be that contour of shoulder is normal. Contour of shoulder is normal, right? ये सबसे important point है. Don't miss them कि contour of the shoulder will be okay. So exam में don't get confused. If they are saying patient was taking phenytoin, phenobarbital for last so and so duration, and उसके बाद में now he got a trauma, he got a jerk, और उसके बाद इसका shoulder is not working well, so it can be a case of posterior dislocation because यहाँ पे contour will be absolutely okay. Contour will be normal, right? Contour will be absolutely normal. Okay, so please do remember. और इसी के अंदर अगर contour will be normal, X-ray shows a very typical sign. What do you call that sign? When the head of humerus is just turned in like this, right? When the head of humerus is just turned in like this, and what do we call that? It is called as the electrical bulb sign or the lighthouse sign. The electric bulb sign or the lighthouse sign. Electric bulb sign or the lighthouse sign, right? So patient, the case of epilepsy or electric shock. So don't forget, right? ये keywords होंगे exam के अंदर. Okay, so inferior wala is not a question for the exam usually. Interposterior dislocation. And now the third part of this. Dislocations में सबसे important point is the complication. देखो, complication of proximal humerus injury, complication of shoulder dislocation, they are same. Proximal humerus, it simply is the shoulder joint, right? So it will be same. Okay. Complication में there are two questions you have to remember. There are two questions you have to remember, that what is the most commonest complication of shoulder dislocation? What is the most commonest complication? What is the most commonest complication? It will be recurrence, right? It will be recurrence. And when you say recurrence, अगर यही recurrence anterior dislocation में बार बार हो रहा है, if the dislocation is involving, if it is anterior, if it is anterior dislocation बार बार होता है, dislocation होने से क्या होगा? There can be lesions, there can be defect of the bone. जब ये एक दूसरे से friction करेंगे, so they will destroy each other. And what kind of lesions can be seen? There are two lesions we can see. One is called Bankart, right? One is called Bankart, other one is called as heel sac. One is called Bankart, other one is called as heel sac. What is that Bankart? Bankart is a defect कहाँ पे? Antero-inferior margin of glenoid. Highlight करो. This is one of the most potential question for the exam, right? This is one of the most potential question for the exam. Bankart कहाँ होता है? Bankart is seen at anterior-inferior margin of glenoid, right? And where do you see heel sac? Heel sac is seen on the posterolateral aspect of humeral head. It is seen on the posterolateral aspect of humeral head, right? It will be seen on the posterolateral aspect of humeral head. Okay, so heel sac and Bankart, ये दो lesions हैं, आपको याद होने ही चाहिए. No excuses on that, right? ये याद होने ही चाहिए. No excuses on that. Bankart is very important for this exam. Okay, second wala. Second question which will come from complication part, which can come from complication part is, what will be the most commonest acute complication? What will be the most commonest acute? देखो, acute word. Now this word acute has been added here. Acute मतलब क्या? Immediately when the trauma happens, and immediately which can be the the structure which can be the anatomical structure which can be damaged if it is a immediate instant injury, right? So instantly क्या damage हो सकता है? It has to be axillary nerve. It has to be axillary nerve, and you know that axillary nerve अगर damage होगी किसी में, so what will be the presentation of the patient? If it is axillary nerve damage in somebody, then what will be the presentation? The presentation will be motor component and sensory component, right? Axillary ka sensory component, what do you call that? Loss of sensation on the upper lateral aspect of the shoulder area, right? And that will be called as the regimental badge sign. That will be called as the regimental badge sign, right? And what will be the motor component? What all muscles will be affected here? One will be deltoid and one will be teres minor. One will be deltoid and other is teres minor, right? Deltoid and teres minor. Okay, so do remember ये दोनों ही MCQs बहुत important है. Both are very important MCQs. Your axillary nerve acute injury वाला and second one this one, the most commonest complication वाला, that is recurrence over here. यहाँ पे highlight कर लो please. दोनों बहुत important है, deltoid and teres minor. Very good, teres minor. Absolutely correct. Everybody is answering very correctly. So supracondyles, lateral condyle, the shoulder dislocation, ये तीनों बहुत important topics हैं, and their complication, every line is a MCQ for us for the exam, right? सबसे common repeated part है ये. So we are done. Proximal humerus वाला, shoulder dislocation वाला. Now in the injuries, one of the very commonly asked question, और अभी ना recently जो INSET के exam हुआ, there also they asked 2 questions on the same part, right? The question was on the proximal femur, that is fracture neck of femur. So next topic I'm taking up here is the fracture neck of the femur, right? It is the fracture neck of the femur. In the fracture neck of femur, देखो fracture neck of femur में I want you all to remember 2 most important things, right? I want you all to remember 2 most important things. What are those? Number one is the classification system, right? Number one is the classification system. What is the classification system which is used for the fracture neck of the femur? What is the classification system which is most commonly used for the fracture neck of the femur? It is anatomical classification based on anatomy. क्या मतलब हुआ based on anatomy? So we divide them into 3 kind of injuries. You all remember 3 kind of injuries? One is subcapital, one is subcapital, one is transcervical, one is transcervical, and third one is basicervical. Third one is basicervical. So subcapital, transcervical or basicervical, right? These are the classification systems which are used. The first one is anatomical one, right? अब आपको पता है इन दोनों में से upper two, they are which kind of injuries? Upper two are which kind of injuries? They are intracapsular injuries, right? They are intracapsular injuries. Capsule के अंदर है ना injuries. And what is the complication related to them? Intracapsular injuries. The complication related to them, it is avascular necrosis. That is avian. Avascular necrosis. So avian is the most commonest complication related to intracapsular fractures. And this third one is extracapsular. This third one is extracapsular, outside the capsule. It is extracapsular, that is outside the capsule, right? Here we have the treatment plan. Then second important चीज जो सबको याद होनी ही चाहिए without a fail, each one of you must remember, it is the treatment plan. Now how to treat the fractures of the neck of the femur? How to treat the fractures of the neck of the femur? What is the treatment plan? It depends on the age of the patient, right? It depends upon the age of the patient. Okay, so if age is physiological age is less than 65 years, right, or it is more than 65 years, right? More than 65 years, what is the plan? You all know the answer. More than 65 years, what is the plan? You all know the answer. The plan is replacement, right? As simple as that. कुछ और देखना ही नहीं है, right? It has to be replacement. Okay, more than 65, replacement. And कौन सा वाला replacement? हेमी आर्थ्रोप्लास्टी. हमेशा उतना ही चेंज करना है जितना जरूरत है. It is hemi arthroplasty, right? It will be hemi arthroplasty. बट अगर आपके एग्जाम में in your exam if they give you the question and they say that if it is arthritis which is present, अगर क्वेश्चन में arthritis present होगी तो क्या करोगे? Then we have to go for THR, then we plan for THR, right? बहुत बहुत इंपॉर्टेंट है, रिप्लेसमेंट हाफ की full only when it is arthritic changes, right? In less than 65 what we do? In less than 65 please remember, अगर पेशेंट अर्ली प्रेजेंटेशन के साथ आ रहा है, इफ द पेशेंट इज कमिंग टू यू विद अर्ली प्रेजेंटेशन, अर्ली का मतलब अभी हेड खराब होना शुरू नहीं हुआ है, राइट? सो हम क्या करेंगे उसके अंदर, अर्ली प्रेजेंटेशन में वी विल सी after the session, can you share us a custom module for orthopedics? I can share, but that custom module will be I think allowed only till 11:59 p.m, right? So I can share with you 30 questions. 30 questions I'll share with you so that you can do it quickly. Okay, अभी session चल रहा है, so 11:59 or maybe tomorrow morning, whatever time you want. So I'll share with you. Don't worry. अर्ली वाले में क्या करोगे? अगर एवियन नहीं है, नेक्रोटिक पैचेस नहीं है, नेक्रोटिक चेंजेस नहीं है तो क्या करोगे? ओके, सो इसके अंदर इफ इट इज इंट्राकैप्सुलर फ्रैक्चर, इंट्राकैप्सुलर मतलब व्हेन इट इज अ सब कैपिटल, व्हेन इट इज अ सब कैपिटल होगा फ्रैक्चर या ट्रांस सर्वाइकल होगा तो क्या करोगे? ऐसे केस के अंदर वी जस्ट गो फॉर द फिक्सेशन बाय कैन्युलेटेड कैंसलस स्क्रू. आंसर क्या मार्क करना है? कैन्युलेटेड कैंसलस स्क्रू, राइट? And if it is basi cervical fracture, if it is basi cervical fracture, आपको पता है basi cervical is what kind of injury? It is outside the capsule. So here what we are going to do, we are going to put a DHS, dynamic hip screw, right? Dynamic hip screw. And if it is a late presentation, late मतलब क्या? If it is a late presentation, late का मतलब क्या होगा? Late में जब some necrotic changes may be starting, may be present, so we have to provide a new blood supply. And how to do that? It is done by the procedure called as Mayer's pedicle graft. You remember? And which muscle is to be used? Please remember that. That was not quadriceps. It was quadratus femoris. It was quadratus femoris. So please remember that. Quadratus femoris, cannulated cancellous screw, hemiarthroplasty and THR. Right? So this is, you have to remember. ये तो याद करना ही है. Both the things are very, very important. The fracture neck femur and this picture in front of you, right? This picture in front of you is very, 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 very important. कोई doubt ही नहीं है इसमें, right? So remember, इतना table जो मैंने बनाया है, इतना याद होना ही चाहिए. There is much more to it, right? And overall, one final line. Overall, if some question asks you, overall, what is the most commonest complication for the fracture neck of femur? Most commonest complication for fracture neck of femur, it is avascular necrosis followed by non-union of the bone. So most commonest complication क्या होगा? Avian followed by non-union of the bone, right? So do remember this. This all is very important. So treatment part is also important. Classification part भी पता होना चाहिए. Intracapsular and extracapsular, right? This is fine with everyone. याद रहेगा? No mistakes. No mistakes in this. Most common complication, Dr. Goals. Most commonest complication is neck of femur is non-union or avian, but it is avian, right? This is fine. Badhiya. Chalo, good. Very good. Very good. Let's keep going. Okay. Fracture neck of femur, non-union. Very good. Avian followed by non-union. Very nice. Chalo. Next topic क्या है? Fracture neck femur is important. I've told you that. Fracture neck of the femur is done from our side. अब आओ nerve injuries में. देखो nerve injury में radial, median, ulnar. I'll just simplify that for you. पेरिफेरल नर्व इंजरी के अंदर ना थोड़े से इंपॉर्टेंट जो पॉइंट्स हैं, आई विल गिव यू दैट. देखो पेरिफेरल नर्व में 2 से 3 इंपॉर्टेंट पॉइंट्स. सबसे पहले इंपॉर्टेंट पॉइंट्स पे लेते हैं. द पेरिफेरल नर्व इंजरीज, राइट? द पेरिफेरल नर्व इंजरीज. पेरिफेरल नर्व इंजरी के अंदर यू हैव टू अंडरस्टैंड, पेरिफेरल नर्व इंजरी में you are not dealing with the cranial nerves, you are not dealing with the spinal cord, we are dealing with the roots L4, L5, C7, C8, T1, T2 like that, right? अब इसके अंदर सबसे पहली चीज which is not mentioned here, लेकिन फिर भी I want you all to remember, it is the classification. Which classification I want you to remember? I want you to remember at least the Seddon's वाली classification. Seddon वाली याद है सबको? जल्दी से बता दो quickly in the chat box. Seddon's वाली classification में what are the different types of injuries we have? Quickly बताओ फटाफट. sedans में what are the types of injuries that you can see? Number one is neuropraxia. Number one is neuropraxia. Now what is that neuropraxia? Neuropraxia means क्या होता है neuropraxia? It is a physiological reversible kind of conduction block, right? It is physiological reversible kind of conduction block, physiological conduction block. सबसे कॉमन एग्जांपल हमारी रूटीन लाइफ में, डेली लाइफ में क्या होता है? व्हेन वी आर सिटिंग क्रॉस लेग, जब आप एक पैर पे दूसरा पैर रख के बैठ जाते हो, है ना? नर्व गेट्स कंप्रेस्ड, एंड इफ द नर्व इज कंप्रेस्ड, इट इज नॉट अ इंजरी. You relieve the pressure and it will be absolutely okay. Second grade of injury we know is exontemesis. Second grade of injury we know is exontemesis. Now what is the meaning of exontemesis? Injury to axon, right? Injury to axon. Or agar if there is an injury to the axon, then what is the name of the covering of the axon? It is endoneurium, right? It is endoneurium. Okay, so axonal injury plus endoneurial injury, right? Okay, exontemesis. And number 3 is neurotomesis. Neurotomesis matlab complete transaction of the nerve. Neurotomesis का मतलब there is complete transaction of the nerve. Nerve is completely cut, right? So that is a complete transaction. So इसमें आपको क्या करना पड़ेगा? यहाँ तो surgeon has to repair. There is no other option. So it is complete transaction of the nerve. There is no other option, and there is no other option, and it has to be repaired. So peripheral nerve injuries, the classification: sedans, neuropraxia, exontemesis and neurotomesis. Very good. अब इसमें जो याद रखना है, that is exontemesis, which is the real nerve injury where the nerve sheet may not be damaged. Which is the real nerve injury when the nerve sheet may not be damaged? That is exontemesis. Remember this. Okay, remember this. Okay, example. अब आते हैं example के ऊपर. Shivani is asking for example. बेटा example for neuropraxia, commonest one is Saturday night palsy. Right? It is Saturday night palsy. Exontemesis will be a clinical diagnosis, and there the person will have the recovery of the nerve, right? Exontemesis में median nerve हो गई, ulnar nerve हो गई, any nerve can be involved, but there will be a gradual progression, there will be a gradual recovery. इसमें क्या मिलेगा exontemesis में? Patient के अंदर gradual recovery आपको मिलेगी. So you will come to know that it was exontemesis only, तभी वो recover कर रहा है, because neurotomesis में तो there is a complete cut. तो अगर कट हो गया तो सर्जिकल रिपेयर ही करना पड़ेगा. ओके, आई होप शिवानी समझ में आया ये वाला. शिवानी को समझ में आया क्लासिफिकेशन पार्ट. सेकंड वन अबाउट दीज नर्व इंजरीज. ओके, देखो रेडियल नर्व का ना, आई ड्रॉ वन वेरी वेरी सिंपल पिक्चर फॉर यू एंड यू विल बी एबल टू अंडरस्टैंड बाय दैट रेडियल नर्व ओनली. You will be able to understand by this radial nerve. Okay, you will be understanding this. See, when you see, look at the glenoid here, the head of the humerus. ठीक है, draw this, remember this picture, इसको याद रखना, and things will be very very easy for you. Now when you just see the course of the radial nerve कैसे आती है नीचे, how does it go down? Radial nerve का पिक्चर कैसा होता है? In the green will be radial nerve. Radial nerve is a continuation of posterior cord of the brachial plexus, runs via medial side of the humerus, goes along the spiral groove, comes on the lateral side, and it stays in front of the lateral condyle. Then it goes superficially in forearm and then behind the interosseous membrane. So dotted one is the posterior interosseous nerve, right? This solid line is superficial branch of the radial nerve. अब इसका PIN का काम क्या होता है? रेडियल नर्व का काम क्या होता है? So ऊपर you have a radial nerve which is over there on this side. It goes back and stays on lateral side, right? ऐसा ही है ना? So now when you to look at this, just remember two muscles और हमारे को बहुत easy हो जाता है इसको याद रखना, right? The first muscle it supplies is here, that is triceps. Triceps का कौन? The long head of triceps, right? It is long head of triceps, and in the radial groove it supplies the other two heads, that is a lateral head or the medial head of the triceps, right? Second one you should remember is ECRL, right? ECRL is supplied just before the nerve bifurcates in front of the lateral condyle, right? अब देखो चार स्ट्रक्चर है आपके पास, ट्राइसेप्स है, ECRL है, PIN है, सुपरफिशियल ब्रांच है. इनके ना फंक्शंस लिखो. I'll tell you in the very simple way how to remember the radial nerve. देखो functions if I write on this side, functions if I write on this side, okay, we'll just simplify that. First function I'm writing, or a function I'm writing, is as the extension of the wrist. कौन कर रहा है extension of the wrist? It is being done by triceps. My bad, मैंने गलत लिख दिया, extension of wrist नहीं, extension of elbow, मैंने गलत लिख दिया, my bad, I'm so sorry. Extension of the elbow, it is being done by triceps. That is action 1, first wala action. Second action is extension of the wrist, right? Wrist extension हमने किसका नाम लिखा है यहाँ पे? ECRL, right? Extension of the wrist by ECRL. Number 3 हमने लिखा PIN, extension of the fingers. Extension of fingers is being driven by PIN, the post-introitious nerve. And what is the function of the superficial branch? The sensation at dorsum of hand. Sensation at dorsum of hand, right? कौन supply कर रहा है यहाँ पे? Dorsum of hand, this area, the superficial branch of the radial nerve. किससे? The superficial branch से. The superficial branch, okay, superficial branch of the radial nerve, right? अब देखो, अगर इंजरी के लिए, if they say that injury to somebody has occurred here in axilla, अब सोचो इसको, अगर if somebody has got an injury at axilla, क्या होगा? अभी तक किसी भी मसल को सप्लाई किया गया है नंबर 1 पॉइंट पे, राइट? If number 1, if I say this as site and the presentation, इसको याद कर लो and it will be very easy for you to answer anything in the exam. Site 1 क्या है हमारी? Site 1 is axilla, right? अगर axilla में चोट लगी तो ABCD में से कुछ भी बचेगा? Will there be anything preserved out of this ABCD? Anything will be, like anything will be spared? कुछ भी? Loss of all, सब खराब हो जाएगा. Loss of A, B, C, D, all gone. कैसे आएगा patient? I have a very good picture to show you. ये picture मुझे, I was just scrolling through some of the like this. I'll show you this one. देखो, I'll show you this. ये ना मुझे स्क्रॉल करते करते आई गॉट दिस ऑन फेसबुक ओनली. सो ये पिक्चर देखो, ये मूवी आपको याद भी आ जाएगी. लुक एट दिस, ये मूवी याद है? लुक एट दिस मूवी, ये याद है? सो लुक एट परेश रावल, यू कैन सी परेश रावल जी का हाथ देखो, एल्बो इज फ्लेक्स्ड, रिस्ट इज फ्लेक्स्ड, फिंगर्स आर फ्लेक्स्ड, नो, ऐसे सब कुछ फ्लेक्स है. तो क्या है? व्हाट काइंड ऑफ इंजरी इज दैट? व्हाट काइंड ऑफ इंजरी इज दैट? कहां पे है ये इंजरी? व्हाट डू यू कॉल दिस? So when injury occurs in axilla, और क्या बोलते हो आप इस इंजरी को? You call it the crutch palsy, right? We call it what? The crutch palsy, right? This is called crutch palsy. Okay? अगर injury occurs here in the spiral groove, अब अगर इंजरी यहां है तो क्या होगा? What will change? If the injury is in the spiral groove, then you know very well कि अभी one head of the triceps has been already supplied. Right? So this is the second one. अगर spiral groove में है तो what has been supplied already? The triceps का long head, lateral head, medial head is not yet supplied, right? So this will have a weakness of the extension of elbow. Weak होगा, but weak होगा, right? Weak होगा. But what about the rest of the things? Extension of the wrist, extension of the fingers, and sensation. So loss of all the other three. Now this one is what we learn as, somebody was saying na, Saturday night palsy. Example कहाँ पे होगा? So this is what Saturday night palsy is. Okay, so Saturday night कैसे हम usually define करते हैं? That person was drunk and he sleeps with his arm over the chair like this. Okay, so it will be lost. Third is the shaft. यहाँ बहुत याद करने का कुछ नहीं है shaft में, but remember this one. ये जो head of radius पे है, ये fourth वाला. Third I'm not writing, but fourth वाला is very very important. Fourth one is radial head. अब देखो radial head के पास which is the nerve in the close proximity to radial head? Which nerve is there in the close proximity of the radial head? It is the PIN, right? So यहाँ पे hit होगा loss of क्या? Loss of extension of the fingers, loss of action C, and it will be called as what? Finger drop. और अभी थोड़ी देर पहले we were talking about the Monteggia fracture. You remember? We were talking about Monteggia fracture. So this radial head injury, it is basically involving PIN. It is related to which injury? The Monteggia fracture. Right? इसलिए there is only finger drop, no problem in the extension of the wrist or any trouble with the wrist or sensation or the elbow, nothing, absolutely okay. It will only have the droop of the fingers, right? This is okay. ये radial nerve वाला याद रहेगा सबको. Radial nerve के बाद I can tell you about the median nerve and the ulnar nerve also, right? देखो, median nerve में ulnar nerve में याद करने वाला point क्या है? What is so important to remember in the median nerve or ulnar nerve? Median nerve, you know that it is also called as the laborer's nerve, right? Median nerve is also called as what? The laborer's nerve. Why it is called as laborer's nerve? Because it controls the bigger muscles of the hand, like FDP, FDS, the main flexors of the fingers. Okay, and the ulnar nerve, you know, they control the intrinsic muscles of the hand, smaller muscles. So they are responsible for fine movements. So it is also called as the musician's nerve, right? Laborer's nerve or the musician's nerve, right? अब देखो इनको इजी कैसे बना सकते हैं? हाउ टू मेक द मीडियन नर्व अल्नर नर्व इजी? बहुत हौच पौच है, बहुत सारा कचरा है ना, इतना सारा हो जाता है कि हमारे दिमाग में सब मिक्सअप हो जाता है. सिंप्लीफाई कैसे करें? देखो, मीडियन नर्व अल्नर नर्व, यू शुड रिमेंबर अ फ्यू बेसिक पॉइंट्स. अगर कुछ बेसिक पॉइंट्स याद रखोगे तो इट विल बी वेरी वेरी इजी, राइट? ओके, वेरी गुड. सो व्हाट ऑल आर द बेसिक पॉइंट्स? मीडियन नर्व और अल्नर नर्व, दे हैव नो सप्लाई, they have no supply in axilla, they have no supply in arm, right? So ये दो जगह पे तो इनकी कोई सप्लाई है ही नहीं. No supply in the axilla, no supply in the arm. So their first supply is in forearm area. इसीलिए whatever clinical test we do, it goes in the wrist or the thumb और द फिंगर्स. ये तीन जगह पे आपको चेक करना है, राइट? तो रिस्ट में बहुत इंपॉर्टेंट कुछ नहीं है बताने के लिए. मसल्स हैं, चेक करते हैं, क्लिनिकल टेस्ट भी हैं, बट बहुत सिग्निफिकेंट नहीं है, राइट? नाउ कम ऑन टू द थंब पार्ट. हाउ द थिंग्स विल बी चेंज इन द थंब पार्ट? देखो, थंब के अंदर व्हाट ऑल हैज टू बी असिस्ट? थंब के अंदर मीडियन नर्व की साइड में, यू नो, दिस 1 2 3, this 3.5, it belongs to what? Median nerve, right? This 1.5, it belongs to ulnar nerve, correct? You all know about this. Okay, अब देखो थंब में पहले मीडियन नर्व की साइड, I'll tell you the important ones, only the important ones, highlighted ones. थंब में what you have to remember, कौन सी मसल I'll put in green, right? Abductor pollicis brevis. देखो थंब का abduction चेक करना है. How to check for the abduction of thumb? Thumb का abduction is like this. Ask the patient to keep the hand on a table and move his thumb up in air like this. Move his hand or thumb up in air like this, right? कौन सा टेस्ट हुआ ये वाला? Which test is this? Very good, very good. It is pen test. Test in the blue. So abductor pollicis brevis के लिए आपने कौन सा टेस्ट किया? Pen test. So exam में if you get a picture जिसमें patient's hand is like this and he's trying to touch something like this, तो कौन सी nerve के लिए टेस्ट कर रहे हो? Median nerve के लिए. But very very important part here. Remember the red flag. Remember this red flag here. कि यहीं पे जो abductor pollicis longus है, it is not getting a supply from median nerve. It gets a supply from what? Radial nerve. It gets a supply from radial nerve. Another important point, right? दोनों को highlight कर लो. Pen test and the radial nerve. Okay, pen test और APL, it is not supplied by median nerve, it is supplied by radial nerve. याद रहेगा? Not supplied by median nerve, it is supplied by radial nerve. It should be remembered. Okay, one in the thumb. अब दूसरी साइड आओ थंब में. थंब में you come to the ulnar nerve side. थंब में ulnar nerve में क्या चेक कर सकते हो आप? अल्नर नर्व का क्या है थंब के पास? The muscle which it supplies is adductor pollicis. The muscle it supplies is adductor pollicis. कैसे चेक करेंगे adductor pollicis? Ask the patient to hold something between the thumb and the finger like this. Okay, अगर ये adduction is okay, this diary will not fall down, right? Okay, so now it will not fall down. Now if this is okay, it will not fall down. Otherwise क्या होगा कि गिर जाएगा ऑब्जेक्ट. अब ऑब्जेक्ट ना गिरे उसके लिए पेशेंट क्या करेगा? He is going to pinch it. So instead of using adductor pollicis, what he is going to do? He is going to use flexor pollicis, right? Instead of using adductor pollicis, what he is using? Flexor pollicis, right? So इसको लिखो. Now write down. So test for adductor pollicis is called as which test? It is called book test. So in your exam, if you get a picture जिसमें, प्लीज रिमेंबर, इसको ध्यान से सुनना, अच्छे से सुनना. इन योर एग्जाम इफ यू गेट अ पिक्चर लाइक दिस, आई होप एवरीबडी कैन सी मी, राइट? सो इफ यू गेट अ पिक्चर लाइक दिस एंड वन ऑफ द थंब इज लाइक दिस, देखो ध्यान से, दिस थंब इज अडक्टेड. ओके, आई होप यू ऑल कैन सी मी इन द कैमरा वेरी वेरी प्रॉपरली. ओके, ध्यान से देखना इसको. This thumb is adducted, but this thumb, it is flexed. Now they ask you, बताओ कौन सी nerve को test कर रहे हो? तो thumb देख के median nerve mark नहीं करना, right? Thumb देख के don't mark median nerve. If one of the thumb is flexed, then you know that it is the ulnar nerve which is gone. And if ulnar nerve is gone, then use of the other muscle, use of which muscle? Use of flexor pollicis. उसको आप क्या कहते हो? Somebody said very correctly. It is called as Froment sign, right? उसको आप क्या बोलोगे? It will be called as the Froment sign. Very good, right? ये वाला याद रहेगा सबको. This is Froment sign. So thumb में टेस्ट कर लिया आपने. And all of these, all 3-4 here जो लिखा है हमने, these are your questions. Okay, don't miss them. So this is thumb. Second one. अब second one देखो. If you have to check for the median nerve in the level of injury. अब देखो, it all depends upon the level of injury. अगर एक पेशेंट में सोचो, अभी आर्म में कोई सप्लाई नहीं है, एक्सिला में कोई सप्लाई नहीं है. So if the nerve gets injured in axilla in the arm area, that means the complete power of the nerves are gone. पूरी nerve ही खराब हो गई, right? पूरी nerve ही खराब हो गई. So if it is a high level injury, high level मतलब अगर किसी पेशेंट को आर्म में इंजरी है अल्नर नर्व की, right? So all supply, all the flexors of the fingers are lost, right? And what that leads to, क्या sign बन जाता है उससे? That will be called as the pointing index sign, right? That will be called as what? The pointing index sign, right? और अगर यही किसी को median nerve, if it is injured at a low level मतलब wrist में अगर किसी को कट लग गया, median nerve का कट यहाँ लग गया, तो what does it come with? तो long flexors तो सेव हो गए, FDP, FDS will be okay, but the thenar area muscles, they will be damaged, other than adductor pollicis, है ना? adductor को तो supply ulnar से मिल रही है, okay? So that produces what? That produces ape thumb deformity. So ape thumb अगर deformity है तो भी median nerve है, pointing index है तो भी median nerve है. Now what about the other side? What about the other side? देखो other side में what is important is high low level injury. हाई लेवल के अंदर बहुत सिग्निफिकेंट क्वेश्चन कुछ नहीं है. नाउ इफ समबडी हैज गॉट अ कट ऑफ द रिस्ट एरिया, अल्नर नर्व यहाँ पे, व्हाट विल चेंज? देन दे प्रेजेंट विद व्हाट? दे विल हैव लॉस ऑफ ऑल द इंट्रिंसिक मसल्स, एक्सेप्ट कौन सी वाली इंट्रिंसिक बच जाएगी? द लैटरल टू लंबराइकल्स एंड थंब मसल, दे विल बी स्पेयर्ड, right? So picture, the presentation will be seen only in these two fingers, right? And that produces what? That produces ulnar claw hand. That produces ulnar claw hand, right? That is going to produce what? Ulnar claw hand. Okay, so high level pointing index sign. तो अगर ऐसा पिक्चर आए कोई एग्जाम में, this one or this one, this is an injury to median nerve. If the picture is something like this, ape hand, median nerve. If the picture is like this, these two are clawed and this one is fine, देखो, right? These two are clawed and these two are okay, then it is ulnar nerve. Okay, so don't mix up. Okay, और कभी भी किसी को क्लॉ होगा तो what kind of splint you are going to use? इनके लिए splint कौन से यूज करते हैं? The splint to be used for the clawing of the hand is knuckle bender, right? The splint to be used is knuckle bender splint. It will be knuckle bender splint. Okay, yeah. अभी ये low level injury पे है, knuckle bender splint use करोगे क्लॉ के लिए. And in the ulnar nerve, the third part, in the ulnar nerve third part, हम कभी कभी इस टेस्ट से कंफ्यूज हो जाते हैं, तो आई एम पुटिंग दैट टेस्ट ऑल्सो. नंबर थर्ड इज अबाउट द इंटरऑशियाइज, राइट? यू नो दैट जो छोटी मसल्स हैं, दे आर गेटिंग ए सप्लाई फ्रॉम अल्नर ओनली. सो वी हैव टू ग्रुप्स ऑफ इंटरऑशियाई, द पामर ग्रुप, द पैड एंड डैब. ये पता है ना सबको, पैड एंड डैब. हाउ टू चेक फॉर दिस पैड? adduction power, palmar interosseous, they adduct. How to check this? So we ask the patient to hold in between the fingers a piece of paper, right? Just a piece of paper, I'm going to hold in between my fingers. So now if it easily comes out, that means I can't hold it. So adduction power is weak. And what do you call that test? Now adduction test will be called as what? The card test. Adduction test is called as simply the card test, right? So card test कहाँ किया? छोटी मसल्स के लिए. Book test कहाँ किया? बड़ी मसल के लिए. Okay, so book test is for thumb, card test is for finger, right? This is about your median nerve and the ulnar nerve. So remember, laborers and ulnar, no mistakes. और एक splint रह गया ऊपर. Radial nerve में, if there is a drop of the wrist, if there is a drop of the fingers, right? How do we treat them? What kind of splint is to be used for radial nerve injury? Because we have to keep the limb elevated. ऐसे उठा के रखना है. You have to keep fingers elevated or wrist elevated. So what do you call that splint? It is called as cock-up splint. it is called as cock-up splint. So splint used for radial nerve is cock-up splint, right? So ये नाम जो आपको sir pronator syndrome will represent as, better pronator will be in the forearm only, right? So pronator syndrome will have the loss of the flexor of the fingers as well, right? That will also have the loss of flexor of fingers, but you know that the FDS, FDP, they will have variable supply, right? So pronator wala question, it is a little complicated one, or I would not say complicated one, but it is unusual to be asked in the exam. So I am here putting all the volatile points जो mix up नहीं होने चाहिए, बिल्कुल अलग अलग होने चाहिए सारे, right? So I'm not going into the कि cubital tunnel में क्या होगा, pronator में क्या होगा, Kiralgia में क्या होगा, अलग अलग. I'm not going into that, right? तो अभी इसको थोड़ा थोड़ा सिंपल रखो, अभी इस टाइम पे कंफ्यूज नहीं हो, राइट? ये लिखा सबने, हो गया? मीडियन नर्व, रेडियल नर्व, अल्नर नर्व इज ओके विद एवरीवन? क्विकली क्विकली बता दो फटाफट, आर दे ओके विद एवरीवन? हमारा चार्ट कहाँ गया? चार्ट बहुत ऊपर पहुंच गया है. ओके, सो okay, so now this one, in peripheral nerve injuries we have done median, radial, ulnar. On case splints I have told you, right? In case splints. Now when you're asking me Harsh about the nerve, इसमें site or the nerve involved, this is one of the part which I'm going to take up, right? कौन कौन सी साइट पे, I want you all to remember कौन कौन सी nerves, इनको याद कर लो. कॉमन वाले कौन सी साइट पे कौन सी nerve involve हो सकती है, and we call it what? They are called as entrapment neuropathies, right? They are called as entrapment neuropathies. ये जरूर याद कर लो that at what level which nerve can be involved. That will be entrapment syndromes, right? कौन कौन से कॉमन है हमारे एग्जाम के लिए? दैट इज ऑन 12th. सिंपल वाले, सबसे सिंपल वाले, कॉमन वाले, जो सबसे ज्यादा ओपीडी में हमारे पास आते हैं. नंबर वन, कार्पल टनल. नंबर वन, कार्पल टनल. विच नर्व? इन कार्पल टनल यू ऑल नो इट इज द मीडियन नर्व, right? Carpal tunnel, which nerve? Median nerve, right? Second, another entity which occurs just in the proximal distal forearm area after carpal tunnel, it is called meningia paresthetica. The meningia तो lower का आ जाएगा, this is chiralgia ना, hand वाला first यहाँ पे hand वाला लिख लो, and then meningia से differentiate, याद रखना chiralgia paresthetica. Chiralgia is for hand, so chiralgia paresthetica में which nerve? Chiralgia paresthetica में which nerve? Chiralgia paresthetica it is superficial branch of the radial nerve, जो sensation provide करती है, right? It is superficial branch of the radial nerve. Third one, like you said Harsha, it is pronator syndrome. Pronator syndrome क्या होता है everyone? Pronator syndrome is the compression of again median nerve in the proximal forearm, right? In the proximal forearm यहाँ पे. Number 4, cubital tunnel, याद रखना ही है, cubital tunnel. Cubital tunnel which is a nerve here under the medial epicondyle. So cubital tunnel will have compression of ulnar nerve. It will have compression of ulnar nerve, right? Number 5, remember in the fractures, supracondylus, lateral condyle, we have already mentioned that, right? Fifth one, we go to the lower limb, like I told you about this one, the lower limb, the meningia paresthetica. You know that this is one of the commonest nerve involved during delivery of the baby, right? And that is lateral cutaneous nerve of thigh, the lateral cutaneous nerve of thigh. Okay, in the posterior dislocation of the hip, right? In the posterior dislocations of the hip, you should know whether there is an exam question on posterior dislocation of the hip, or there is exam question on other than this, they make you a question on, give you a question on neck of fibula. So in the posterior dislocation, it is sciatic nerve, and in the neck, it will be the branch of the sciatic nerve, and both of them, they make the patient's foot go into what complication? Into the trouble of foot drop. Please remember this. Your foot drop is very, very important, right? Please write down foot drop. और अगर किसी patient को foot drop होगा, so what will be the gait of the patient? The gait of the patient will be a high stepping gait, right? It will be a high stepping. पैर ऊपर उठा के चलना पड़ेगा ना, ताकि ankle is not under control. What should be the superficial structure to be affected during surgery over cubital tunnel? What does that mean? ये तो बड़ा vague question हो गया शिवानी. It is a very vague question. You have to be little specific. अब ऐसे superficial structure में तो skin भी है, fascias भी हैं, है ना, fat भी है. After that you are going to find the muscles, फिर nerve आएगी. So it's a very vague question. So ये 6-7 आपको याद रहने चाहिए. These 6 or 7 you must remember, right? ये याद रहने चाहिए entrapment syndrome में. Okay, so Shivani, थोड़ा क्वेश्चन स्पेसिफिक इफ यू कैन डू, इट विल बी इजियर फॉर मी टू आंसर. ये तो नॉन स्पेसिफिक सा क्वेश्चन हो गया बहुत ज्यादा, है ना. सो ये वाले एंट्रैपमेंट सिंड्रोम्स. अब नाउ इट इज अबाउट रिकेट्स एंड पोरोसिस मेटाबॉलिक डिसऑर्डर्स में. ओके, आई विल टेक दैट. देखो मेटाबॉलिक डिसऑर्डर्स में इफ आई टेल यू अबाउट रिकेट्स एंड पोरोसिस, लेट्स अंडरस्टैंड दिस. देखो मेटाबॉलिक डिसऑर्डर्स का ना बहुत सिंपल सा फंडा है. इट इज वेरी 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 इजी, राइट. ओके, देखो मेटाबॉलिक डिसऑर्डर्स का इट इज वेरी सिंपल फंडा. मेटाबॉलिक डिसऑर्डर्स में यू हैव गॉट थ्री थिंग्स. ओके, थ्री थिंग्स. नंबर वन, टू मेक द बोन व्हाट वी नीड इज अ सेल ना. व्हाट वी नीड इज अ सेल. और सेल के जो ट्रबल्स होते हैं ना, सेल के जो प्रॉब्लम्स होते हैं, दे आर टू. वी हैव टू इश्यूज विद द सेल्स. one, the trouble can be Paget's, right, and the other trouble can be osteopetrosis. These are two troubles of the cells. Second one is the cell of the cell's protein, the trouble with the proteins. Protein can have two troubles. One is scurvy and one is osteogenesis, osteogenesis imperfecta, right. ये याद रखना, scurvy और osteogenesis imperfecta. Okay, and the third component we have to make the bone is mineral. और minerals के disorder are which one? Mineral के disorders are बच्चों में होगा तो rickets और अगर adults में होगा तो osteomalacia, right. Rickets और osteomalacia. अब always remember this very very simple fundamental. In your exam if they ask you a question that serum mineralization का क्या होगा rickets में या malacia में, so serum mineral has to go low, right. There will always be a decrease in serum mineralization. अगर serum mineral low है तो it will not be a case of rickets or malacia. As simple as that. Scurvy में, osteogenesis में, Paget में, petrosis में, there will be no change in the mineralization, right. So in your exam if you have a question of decreased mineralization, it cannot be rickets or malacia. As simple as that. Second part of this, अगर एग्जाम में क्वेश्चन आ रहा है देखो ऑस्टियोपोरोसिस पे, तो सबसे पहले तो क्वेश्चन की लैंग्वेज को रीड इट वेरी वेरी केयरफुली. ऑस्टियोपोरोसिस का पेशेंट कौन होगा? इट विल बी एडल्ट एल्डरली पर्सन, राइट, यूजुअली फीमेल. सो आपको एग्जाम में कौन सा पेशेंट मिलने वाला है यहाँ पे? एल्डरली फीमेल, जिसको ट्रबल्स कहाँ होंगे, प्रॉब्लम क्या होगा? पेन की प्रॉब्लम होगी. कहाँ पे? बैक एक होगा, वर्टिब्रा इन्वॉल्व होगी, या फ्रैक्चर्स होंगे कहाँ पे? नेक ऑफ फीमर में, कोलीज का फ्रैक्चर होगा, ये कॉमन होगा. अगर आपका पेशेंट रिकेट्स वाला होगा तो योर पेशेंट विल बी अ चाइल्ड, राइट, हु विल बी कमिंग टू यू विद व्हाट कॉम्प्लिकेशंस, व्हाट ट्रबल्स? सर डिफॉर्मिटी हो गई है उसको. डिफॉर्मिटी वेयर? इन द लेग्स एरिया, राइट. इट विल बी डिफॉर्मिटी इन द लेग्स एरिया. सो ऑस्टियोपोरोसिस एंड रिकेट्स. तो डू रिमेंबर इन दोनों पे सबसे ज्यादा क्वेश्चन आते हैं. डिफॉर्मिटी में व्हाट आर द कॉमन डिफॉर्मिटीज व्हिच आर सीन इन द केसेस ऑफ रिकेट्स? It can be varus, genu varus, it can be genu valgum, okay, it can be genu varus, it can be genu valgum, or it can be very very important and a question for your exam, it can be wind swept of the legs. Okay, don't forget this, it is wind swept of legs, right, it is wind swept of the legs. So wind swept of legs, this is very important, highlight karo wind swept, this can be a question. Osteoporosis के अंदर there is second point here. After this, the second point will be, after this, the second point is in osteoporosis the serum mineralization, right. Serum mineralization पे कोई negative effect नहीं आता. It has to be normal. Okay, serum mineralization will be normal. Always remember that. Okay, and जब आप osteoporosis के patient को diagnose आपको करना है तो what is the best way to diagnose osteoporosis? It is diagnosed by DEXA scan. DEXA में what is the level to call it osteoporotic? When somebody is going less than minus 2.5 standard deviation, then it is definitely osteoporosis. And what is the first line drug to be started in osteoporosis? What is the first drug to be started? It is always bisphosphonates, right. Don't mark that we are going to go for estrogen, selective estrogen receptor modulators. Nahin, always bisphosphonates will be the first line of drug, right. और typical जो एक्सरे की फाइंडिंग होती है in both the conditions, एक्सरेज इसमें कैसे दिखाई देंगे? Vertebra will have a typical appearance called as what? Codfish. Vertebra will have a typical appearance of codfish, and on the x-rays On the x-rays, what will happen in this case? On the x-rays, in the cases of rickets, what do we find? We find what kind of picture? You can see the white line of healing. व्हाइट लाइन ऑफ हीलिंग. अगर आपके पेशेंट को ट्रीटमेंट ठीक सेट हो गया, फिट हो गया, तो यू आर गोइंग टू सी द व्हाइट लाइन ऑफ हीलिंग ऑन द एक्सरेज, right? So rickets will have the deformities. Please remember, okay? Deformities will be the most commonest picture in the case of rickets, or in osteoporosis में fractures will be the commonest picture. Fluoride deficiency में भी geniovalgum दिखता है. It can be anything. बेटा fluoride deficiency, it is fluorine excess also which can create the trouble, the fluorosis. Okay, yeah, very good. Codfish. Okay, so these are two important things. Don't forget कि patient कौन होगा. So read every word carefully. अगर एक question में you are getting the age of the patient, so that is being given for a reason. बिना reason कुछ भी नहीं होता, right? There is nothing that happens without a reason. So always remember that. All right. So porosis का question गलत नहीं होना चाहिए. Codfish, bisphosphonates, patient कैसे आया? These are all your MCQs about these two, osteoporosis and the rickets part. Right? Now, in the metabolic disorders के बाद you have the topic of bone tumors. देखो GCT, OS और Ewing सबसे commonest ये तीन होते हैं, है ना? Giant cell tumor, osteosarcoma, Ewing sarcoma. So I'll tell you the differentiation part of all of them. I'll tell you differentiation part of all of them. देखो tumors में, if you focus on your all PYTs, tumors में, I'll just put it like this: GCT, giant cell tumor. Second one, थोड़ा सा separate लिख लेते हैं so that we have some little space to write. So second one, osteosarcoma, and third one, Ewing sarcoma. इन तीनों के ऐसे क्या पॉइंट्स होंगे जिसको देख के you will be able to diagnose कि सर ये तो यही है, right? Okay. So giant cell tumor, basically सबसे first thing to be seen in any tumor, सबसे पहले क्या देखना होता है? In any tumor, what you have to see is the location. GCT कहाँ पे होगा? Epiphysis पे. GCT will be at epiphyseal area, right? Osteosarcomas कहाँ पे होंगे? Where you are going to find osteosarcoma? It will be metaphyseal. इसका lesion कहाँ होगा? Metaphysis पे. And Ewing sarcoma कहाँ पे होगा? Where do you find Ewing sarcoma? Where do you find Ewing sarcoma? Ewing's का जो bulk है, Ewing's का जो lesion है, that will be basically diaphyseal. देखो सबसे बड़ा difference तो उनकी location ही हो गई, right? सबसे बड़ा difference तो उनकी location ही हो गई. Okay. Second, GCT, giant cell tumor, सबसे commonest आपको कहाँ दिखाई देगा? All the three tumors are common in the femur bone, upper limb में distal radius. GCT का typical जो feature होता है, that can be basically the soap bubble. GCT का जो typical feature होगा वो कहाँ क्या दिखाई देगा हमें? That will be soap bubble, right? That would be soap bubble appearance. Okay, so giant cell tumor will come up as the soap bubble appearance. Okay, so this will be coming as the soap bubble appearance. Okay, और ऐसे ही अगर osteosarcoma आपको दिखाएगा तो क्या चीज आपको दिखाएगा वहां पे? या तो they are going to show you Codman's triangle, or they are going to show you the sun ray, sunburst appearance, growth basically on the surface of the bone. And Ewing's में क्या दिखाई देता है हमें? Ewing's के अंदर we can see the onion peel appearance, right? Always remember कि GCT जो होगा, it is most commonly seen in adults. Adults का मतलब the age group will be 20 years to 40 years. तो यहाँ पे you will not be able to see the growth plate, right? Osteosarcoma में you should remember that it is the most commonest malignancy of which age group? It is most commonest malignancy of second decade. आपके ज्यादातर पेशेंट जो होंगे वो 11 years to 20 years के बीच में होंगे, right? And in the Ewing sarcoma, the age group, it is the most commonest malignancy. It is the most commonest malignancy of first decade of life. It is the most commonest malignancy of first decade of life, right? Okay, so याद रहेगा how to differentiate. Just look at the sample and you will be able to understand कि वो GCT है कि OS है कि Ewing sarcoma है, right? Always remember this. So osteosarcoma, Ewing sarcoma are purely malignant tumors. Giant cell tumor is a benign aggressive tumor. Okay, all of you will be able to make it. The three typical things about the tumors, don't miss them. Don't miss any of the words over there, right? So bone tumors में you should know GCT, OS, Ewing's for sure. CTV के अंदर, CTV, CDH बच्चों में, ओके CTV CDH बच्चों में चलो I'll tell you the important points about CTV and CDH pediatrics में से these two the most important things in pediatrics CDH and CTV जो नहीं मिस करना है बिल्कुल भी CDH you know that your patient has to be who the patient has to be a newborn baby तो कौन होगा आपके एग्जाम में आपका पेशेंट क्या होगा न्यूबॉर्न बेबी क्लिनिकल टेस्ट आपसे पूछेंगे बताओ which are the clinical test so you should know the two most important tests which are done Barlow's and Otoloni test right and if the patient has come to you as a newborn baby right hip dislocate relocate करके you will see the Barlow's and Otoloni both of them right remember कि अगर इन पेशेंट्स में if they have a neglected CDH तो बच्चा कैसे चलेगा neglected CDH का बच्चा if it is a unilateral neglected one so how does a child walks which gait it will be Trendelenburg gait right it will be Trendelenburg gait okay and if it is a bilateral neglected CDH then child walks with a lurching or the waddling gait it will be lurching gait okay and if ever they ask you the treatment plan image based question can be there treatment can be the image based question can be there so less than 6 months what we can do we can go for Pavlik harness or the von Rosen splint and after 6 months we have another kind of plasters to be given another kind of splint to be given and they are called as what frog leg or bachelor's cast right frog leg or bachelor's cast और उसके बाद फिर surgery right CDH की ये pointers not to be missed and when we talk about the CTV now सबसे पहले what are the deformities which are seen in the CTV foot so this is cavus you know that cave has to be the cavus adduction varus or equinus cavus adduction varus or equinus right second CTV के अंदर what is the method of treatment use कौन सा वाला method use होता है it is called Ponseti technique right CTV का मैनेजमेंट कब शुरू करना चाहिए what should be the age start treatment as soon as possible late नहीं करना है right start treatment as soon as possible preferably within first week of life इसी में आपको शुरू कर देना है and this is the most important part right इसको मिस नहीं करना highlight करो इसको don't have to miss it and Ponseti में once you have corrected the foot right once you have when you are done with all like treatment correction how to maintain that then we go for Dennis Brown splint इसकी इमेज आपको क्लियर होनी चाहिए Dennis Brown splint I hope that everybody can recall that Dennis Brown splint has to be given and once the child starts walking if required then we go for CTV shoes right so order of correction and deformity is the same the order of correction in CTV is same as we have written here what is order of correction C A V E it has to be cave right so beta Sagda Baguio okay I'll share one image with you एक बार उसको go through करना and if it is difficult for you then after today's session I'm planning to have some more Insta sessions in the morning right तो Insta के ऊपर I'll have the quick queries and I'll show you the images I'll give you the quick notes but अभी we are going to only focus upon only these PYTs because I'm taking a lot of time of yours and every single minute is important तो ऑर्थोपेडिक को क्विकली रिवाइज करके वी विल गो बैक टू लाइक अवर रूटीन एंड कुछ बचेगा तो आई टेक योर 15-20 मिनट्स एवरी डे मॉर्निंग और अल्टरनेट डे मॉर्निंग बाकी इंस्टा पे आई डू आई अश्योर यू आई डू दैट यू कैन लीव योर कंसर्न्स ऑन द टेलीग्राम ग्रुप वहां से आई टेक इट एंड आई शेयर इट विद यू राइट सो नो वरीज ऑन दैट ओके सो दो ये पॉइंट्स बिल्कुल भी मिस नहीं करने हैं अबाउट द सीटीवी पार्ट चलो और उसके आगे क्या है हमारे पास सीटीवी पीडियाट्रिक दिस वन डन इन पीडियाट्रिक्स वी हैव द सीटीवी वी हैव द सीडीएच about joint disorders पे okay joint deformities disorders Springle and Klippel fail okay soft tissue and complication चलो I'll just tell you about the joints देखो joint disorder में ना तीन important deformities we have right we have got three important deformities the joint disorders okay joint disorders के अंदर I'll tell you in short the difference between these three. what all you have to remember: OA, RA, and AS, ankylosing spondylitis. Right? How to join Instagram session? That will be on my channel only, beta. You can just search me as Dr. Sushil Vijay, Dr. Sushil Vijay. Search कर लो, उस पे आ जाएगा. I'll share on Triple S group. Don't worry. I'll share there as well. Okay. अभी इधर आओ वापस. Distract मत हो बार बार. देखो, OA के patient में who will be your patient? ये patient होंगे elderly, right? Elderly female. These are usually elderly female who complain of knee pain. आपके एग्जाम में कौन पेशेंट होगा? Elderly female with knee pain. आरए के अंदर it will be a lady somewhere between 25 to 55 years, female, and who complains of what? Usually bilaterally symmetrical involvement of joints, right? Bilaterally symmetrical joint involvement. Okay. Third one, AS, ankylosing spondylitis mein who will be your patient? A young boy, 15 years to 25 years, a male boy who will be complaining of what? Backache. Right, who will be complaining of backache, and this backache will be more after the period of rest. Okay, इसमें morning pain ज्यादा होगा. Okay, so RA, AS और OA के अंदर. अब OA में तो knee pain हो गया. Bilateral wrist वाला patient आपको क्या complain करके आता है? ये RA वाला patient, bilateral wrist is the usual involvement. सबसे commonest कौन सा joint involved है? Wrist. OA में सबसे commonest कौन सा joint involved है? We said knee. Right, और AS के अंदर सबसे commonly क्या involved है? Vertebra, the back. ओके अब एस के अंदर वर्टिब्रा हम ये कह रहे हैं, बट द फर्स्ट जॉइंट विच इज इन्वॉल्व, सबसे कॉमनेस्ट कौन सा होता है? सेक्रोइलिक. द फर्स्ट वन टू गेट इन्वॉल्व इज सेक्रोइलिक जॉइंट, राइट? एंड इन द केस ऑफ रूमेटॉइड, द फर्स्ट यूजुअली इन्वॉल्व इज द रिस्ट और द basically wrist area, or the MCPs are the first one to get involved most commonly, right? Wrist or the MCP are the first one to be involved, right? The red flags, the joint which are usually not involved. देखो OA के अंदर what is not involved? OA के अंदर not involved are which ones? OA के अंदर not involved are which ones? One is the wrist and second is MCP. लेकिन MCP comes with an exception, except for which one? The first one, right? Here, what are the joints which are not involved in rheumatoid? They are the distal IP joint of the hands, usually not involved, and second one is vertebra, right? AS doesn't have anything peculiar like this. It usually involves the spine, usually involves the sacroiliac joint, and so on. Gradually, बाद में तो it can destroy every joint, right? बाद में it can destroy every joint. Okay. Typical thing to be seen in the patients of the deformities. In OA, the classical deformity that we see usually is a genu varum. The typical deformity that we see in the cases of OA, it is typically genu varum. Most commonest deformity that is seen is genu varum, right? And the other two you have to remember. The other two, okay, so genu varum, and in the hands area we have two classical deformities. One is DIP and one is PIP. In the DIP, the deformities, the osteoarthritic changes of the hands, they are called as what? Hubbard's nodes, and PIP will be called as what? Butcherd's nodes, right? Hubbard's nodes or the Butcherd's nodes. Same way, the deformity which are seen in rheumatoid will be what? In the wrist, we have Z deformity. In the wrist, we have Z deformity. And in the fingers, we have two classical ones. In the fingers, we have two classical ones. Which ones? क्या क्या बोलते हो आप deformity को? One is swan neck and one is botanier, right? One is swan neck and one is botanier. याद रहेगा नहीं? ये तो याद है सबको. Swan neck और botanier. And the classical one, right? The classical one which is seen in the cases of AS, it is called as bamboo spine, right? It is called as bamboo spine. Okay, so these points are not to be missed. In the cases of joints, this is how you know that your patient is a case of OA or RA or AS. So please don't miss that, right? The joint disorders, please don't miss that. That will be very, very easy. If you just look at the very first line of your question, की शुरुआत क्या हुई है? Who is your patient? A male or a female? A young boy or an elderly patient? Right? Complaining of pain in the knee or in basically the wrist area, hand area, IP joints like that. Okay. So joint disorders, the OA, the joint disorders, the OA, the RA, and the cases of AS. Okay. Botany, very good. Okay. So do no mistakes in this. So joint के अंदर ये तीनों याद रखना. कैसे you will approach that? Who is your patient? Right? अब देखो deformity में images with reason. So we have already discussed cubitus varus valgus. I have told you cubitus varus valgus, lateral condyle and the supracondyle fractures. So you know cubitus varus valgus deformity, windswept deformity in the rickets. I have told you that. Now coming on to these two, Sprengels or the Klippel-Feil syndrome. See, understand what is the basic difference in these two. Sprengel shoulder. What does it mean, Sprengel shoulder? The basic meaning of the word Sprengel's shoulder. Sprengel simply means the patient has got a failure of descent of scapula. When scapula develops, it is on the upper part of shoulder and gradually it descends down, right? It is the failure of the descent of the scapula. So one of the scapula will be high riding, right? One of the scapula will be high riding scapula, right? It will be high riding scapula. Now, if the patient has a high riding scapula, there will be a discrepancy in the position on the back, which you can easily see. If this Sprengel shoulder gets additional low hairline means the short neck, and along with scoliosis, these three combinedly we include under what we learn as the Klippel-Feil syndrome, right? What we learn as the Klippel-Feil syndrome. This is called Klippel-Feil syndrome. Okay, so Sprengel shoulder, low hairline, scoliosis. This is what you all call as the Klippel-Feil syndrome. Okay, and right, but I'm not able to read your question. What you're writing? Why the chest expansion is reduced in AS? It is reduced because of fusion of the spine. When the spine is not movable, it is not flexible, it will not allow the rib cage to expand. So that is the reason why the patient cannot breathe properly. Okay, so Sprengels और ये वाला concept आया सबको समझ में? Sprengels and Klippel-Feil. This has been one of the question in the past. Nothing to be marked wrong here. अच्छा, दो तीन वन लाइनर्स आई वांट यू टू रिमेंबर along with the fat embolism syndrome. देखो, दो तीन वन लाइनर, please don't forget them. Okay, one liners में the very first one I want you all to remember. The very first one I want you to remember is the first movement lost. The first movement lost in adhesive capsulitis. Right? What is the first movement lost in adhesive capsulitis? Answer will be internal rotation. कैसे? Patient will not be able to keep the hand on the lower back. Okay, patient won't be able to keep the hand on the lower back. Second is the painful arc syndrome, right? Second is painful arc syndrome. Painful arc syndrome may, at what angle there will be problem? The pain will be between 60 to 120 degrees of abduction. It will be painful, right? It will be painful. Number 3, what is lateral epicondylitis? What is that called as? The lateral epicondylitis. What is the name given to this? It is called as tennis elbow, right? It is called as the tennis elbow. Okay, similarly the medial epicondylitis is called as what? Similarly the medial epicondylitis is called as what? It is called as golfer's elbow. It is called as the golfer's elbow. Number 5, what happens in decurvane stenosynovitis? Which tendon is inflamed in decurvane stenosynovitis? In decurvanes, it is abductor pollicis longus and extensor pollicis brevis. Right? What is the clinical test which is done for decurvane stenosynovitis? So the clinical test which is done is called as Finkelstein. Please remember, Finkelstein test or Eickhoff test. Finkelstein test or the Eickhoff test. Right? So decurvane stenosynovitis. These are some of the very common one-liners which you can expect in your exam. Right? Golfer's elbow, medial epicondylitis. Yes, absolutely correct. Okay, these are some of the one-liners you should never miss, and they are the common routine patients in our OPD also. ये common patients होते हैं OPD के, and that is why they are always, you know, the questions of your exam as well. Right? They are the questions of your exam as well. All right. So this is one, and then the last one we have in your chart as well. Something about the fat embolus. देखो, fat embolism is a very commonly, you know, missed thing in the orthopedic wards, right? Yes. So fat embolus का patient कैसे होगा? Fat embolism का question कैसे होगा? you should know that आपका patient होगा जिसको fracture होगा long bone का, right? There will be a fracture of the long bone. Fracture of long bone. कौन सी वाली long bone? Usually it is the fracture of the femur shaft or the tibia shaft. Fracture of femur shaft or the fracture of tibia shafts, right? And usually कितने दिन में symptoms आने शुरू हो जाते हैं? The fat embolus takes usually 24 to 72 hours. That usually takes 24 to 72 hours to come into the circulation, right? And what is the name of the criteria to diagnose it? The criteria is GERD's criteria, right? The criteria is GERD's criteria. GERD's criteria में there are 4 major parameters. Right? It is GERD's criteria. Yes. Okay. So GERD's criteria में there are 4 major criterias, right? 4 major में क्या क्या होता है? If there is a decrease in the pressure of oxygen, the saturation basically below 60 millimeters. That is one. Second one is the petechiae, right? Petechiae in the west distribution, like बनियान जो पहनते हो ना, the west distribution में neck area, chest area, axillary area, like that. Then there can be central nervous system involvement or there can be respiratory system involvement, right? These involvement, patient is getting confused, patient is irritable, is not cooperative, he's shouting. Out of any of the 4, if one major is present, we know that we are going towards fat embolus, right? Always remember, fat embolism hoga to first line of drug has to be steroid followed by heparin, which is little controversial. Some people prefer, some object to it, but steroid definitely is the answer, right? So guys, this is the list of the PYQ that we have, okay, as of now. अब इसके बाद, if any one of you is troubled with any topic of orthopedics, I am planning some session on instruments. I am planning some sessions on the radiological images, important ones, right? On the Instagram, you can connect with me on the Triple S Telegram group, okay? And just leave your queries there. I'll share the link of my Instagram just now on the group also, so you can be there. Or जो भी sessions we have to plan, I'll tell you the schedule. I have to tell you inform prior only, so that you can plan your things. But my sessions will be in morning only, right? Morning में ही करेंगे, so that you all can be a part of it. अब जल्दी उठना शुरू करो. And one piece of advice to all of you is कि बेटा जो एग्जाम देने जा रहे हो ना, उसके अंदर don't think of the questions as questions, think of them as the patients. अब तो physician बन गए हो, अब तो डॉक्टर बन गए हो ना, patient देखने ही है. So think of these questions as a patient. जब patient की तरह देखोगे तो you will understand that why they have given you that age, why have they given you like that gender, okay, and उसका importance क्या है, patient presentation कैसे किया, how you diagnosed, right? So it will be very very easy for you. Second part is, now don't doubt yourself. इतनी दूर अपने आप पे डाउट करने के लिए नहीं आए थे. You all can easily do it and it is absolutely doable. हम ही लोग तो करते हैं ना. You are the ones who are going to pass the exam. तो बहुत आप ही के सीनियर्स करते आए हैं और आप ही करोगे. So it is not something rocket science है कि कल कुछ हो नहीं पाएगा, ऐसा परसों कुछ हो जाएगा. You have been doing wonderful. अच्छे से तैयारी कर ही रहे थे. And we know that we have exam someday. वो तो देना ही है ना. So don't panic, don't worry. Have trust in yourself. Keep control of your mind. And I can tell you one very simple thing. दुनिया की जितनी भी लड़ाइयां होती है ना, सबसे पहले कहाँ लड़ी जाती है पता है? इस छोटे से 6 इंच वाली पिच के ऊपर. If you can win over here ना, अगर दिमाग में अपने आप को जीत लिया तो you all can do everything. I'm telling you this thing. Okay, so once you know that यही मेरा काम है, मुझे करना ही यही है. I have to read, I have to study, I have to pass. हो जाएगा वो. Okay, so I'm not giving you false hopes. I'm just telling you that you have been the honest ones. ईमानदारी से जब बैठ के पढ़ाई कर रहे हो तो रिजल्ट तो अच्छा आएगा ही आएगा, राइट? स्ट्रेस सबको होता है. अगर स्ट्रेस हो रहा है इसका मतलब यू आर अ नॉर्मल पर्सन. मेरा भी एग्जाम होगा कल तो मेरे को भी स्ट्रेस होगा. कोई भी एग्जाम दे दो, है ना. आई बीन टीचिंग फॉर मोर देन अ डिकेड नाउ, लेकिन एग्जाम देना हो तो सबको स्ट्रेस होता है, किसको नहीं होता. सो इट्स एब्सोल्युटली ओके, राइट? सो ओबीजी क्लास है परसों. डोंट वरी, ओबीजी एंड ऑर्थोपेडिक्स विल गो पैरेलल. Parallel in the sense they will not be overlapping. So ma'am की class and my class will be, we are going to give you a proper schedule. जिसमें मैम की क्लास will be on some day it will be my class, some day it will be a common lecture जिसके अंदर we both are going to be there. So mentor duo है तो mentor duo तो साथ रहेगा ही ना आपके. So mentor duo has to be with you and for you, available all the time, and I assure you we are going to do the best we can for all our students. So you can count on us. एग्जाम है, साथ में पढ़ते हैं और साथ में पास भी करते हैं, राइट? सो ट्रस्ट मी ऑन दैट। ओके, सो हो जाएगा उत्कर्ष, डोंट वरी। साक्षी मैम की क्लास के बाद क्या होगा? साक्षी मैम की क्लास विल बी ऑन डिफरेंट डेज, माय क्लास विल बी ऑन डिफरेंट डेज एज आई सेड, और कुछ दिन हम ओवरलैप करेंगे जिसके अंदर आई विल बी देयर इन द सेशन विद मैम। सो मैम अपने टॉपिक्स आपको ऑलरेडी आई थिंक अनाउंस कर चुकी हैं। सो मैम अपना शेड्यूल लेते रहेंगे, हम अपना करेंगे। कोई बात नहीं शिवानी, इन क्लास परसों नहीं है। कस्टम क्या चाहिए होगा ओबीजी का? परसों कस्टम चाहिए होगा तो मैम विल गिव यू, डोंट वरी। मैम नोज बेटर व्हाट इज रिक्वायर्ड। ओके, सो अगर मैम क्लास नहीं लेंगे तो वो शी विल नो दैट शी हैज टू प्रोवाइड द कस्टम मॉड्यूल। और ऑर्थो का कस्टम चाहिए अभी। हाउ मेनी रिक्वायर है कस्टम मॉड्यूल फॉर ऑर्थो? अभी कितने लोग करोगे? शुड आई गिव यू वन 30 क्वेश्चन वाला कोड? 30 क्वेश्चन फ्रॉम द ऐप। हाउ मेनी वांट्स टू सॉल्व जेन्युइनली? जल्दी जल्दी बता दो, सो आई विल गिव यू ट्रिपल एस ग्रुप के ऊपर आई प्रोवाइड अ कस्टम मॉड्यूल ऑफ 30 क्वेश्चंस। जस्ट 30 क्वेश्चंस, क्विकली कर लोगे, अभी तो 10 o'clock है ना, यू स्टिल हैव 2 hours टू डू। ओके, कौन कौन करने वाला है मुझे ये बता दो, सो आई विल प्रोवाइड दैट। कम ऑन लेट मी सी कितने करने वाले हो। ओके, पॉलमी चैटर्जी, उत्कर्ष, डॉक्टर गोल्स, अभी करोगे पक्का? अरे वाह, सो गुड टू सी यू ऑल। चलो, सो ट्रिपल एस ग्रुप पे आई एम गोइंग टू पोस्ट वन कस्टम मॉड्यूल वाला कोड 30 क्वेश्चंस वाला। खाना खाया सबने, डिनर किया? आई होप एवरीबॉडी इज डन विद द डिनर पार्ट। खाना खाओ जल्दी जल्दी, फ्रेशन अप, एंड 30 क्वेश्चंस, राइट? आई एम जस्ट गोइंग टू शेयर, 10 मिनट में करेंगे। वेरी गुड, सो प्राउड ऑफ यू, वेरी नाइस बच्चा, वेरी गुड, वेरी गुड। चलो, so all the best to all of you. Thank you so much for being patient and being here, and let's meet on triple S group। और हो जाएगा, डोंट वरी, राइट? पक्का हो जाएगा। ट्रस्ट योरसेल्फ एंड बी द फिजिशियन मैन। इतने सारे इतना टाइम दिया है खुद को हमने, इसलिए थोड़ी दिया है कि हम डर जाएंगे। पेशेंट कोई भी आएगा देख लेंगे, वी आर गोइंग टू मेक श्योर हमारा पेशेंट ठीक होगा, राइट? पालक रोटी चावल दाल, वेरी गुड उत्कर्ष, वेरी नाइस। ठीक है, हो जाएगा, डोंट वरी, सबका हो जाएगा, डोंट वरी। हैव फेथ इन योरसेल्फ, जो फेथ रखेगा उसका पक्का हो जाएगा। चलो, आई एम गोइंग टू शेयर द कोड इन नेक्स्ट 5 minutes इन द ट्रिपल एस ग्रुप। फ्रेशन अप हो जाओ, खाना वाना खा लो फटाफट। आई एम जस्ट गोइंग टू शेयर, राइट? थैंक यू सो मच फॉर बीइंग देयर एंड ऑल द वेरी बेस्ट टू ऑल ऑफ यू, राइट? हो जाएगा आराम से, राइट? थैंक यू सो मच एवरीवन, बाय बाय।